Blastomyces. Blastomyces is a systemic fungal disease which causes specific disease blastomycosis. Now the genus Blastomyces has a specific organism which we will study, which is Blastomyces dermatitidis. Okay, now how does Blastomyces dermatitidis affect? Now remember that this organism acquires two shapes or two structures. Now when it is outside the body at a specific temperature, it looks like a mold. It is actually a mold. Now this occurrence of a mold is at approximately 20 degrees, and it also consists upon small babies which form spores known as micronida. Now whenever this mold enters in the body, by how? By obviously aerosol, by inhalation. So inside the body it converts or acquires a different shape, hence the name dimorphic, that is yeast form at approximately 37 degrees centigrade, which is normal body temperature. Now yeast, in this, the structure it acquires is a budding shape, a budding type of or oval organism which has a double refractive wall, and it has a broad base of bud. Now this characteristic helps us to differentiating from all of the other organism, which is Paracoccidioides, which has a single similar structure but it has multiple buds, and Cryptococcus, which has a similar shape but it is a narrow based bud. So what happens whenever this organism in the form of mold and it is grown at a certain temperature, it produces or it divides asexually in this form of mold. It produces a little small babies or small buds, which is known as microconida. Now this mold is then inhaled. Whenever it is inhaled, what happens is that it causes, normally it is asymptomatic, but if the patient is immunocompromised or the cell immunity is quite less, it can disseminate into the bone as well as in the skin, and it causes ulcerative type of lesions in that respective area. Now, how do we diagnose such a thing? We diagnose such a thing in such a patient by taking the tissue sample. In the tissue sample, again, we'll see the yeast thing, because tissues are inside the body, and in the body, it is in the yeast form. Now, it is again a thick-walled yeast with a broad-based bud, as we've seen, but if we culture this organism, it will be outside, so it will be in the form of mold. Now we culture it on a special medium, which is known as, for all funguses, we normally grow this on this special medium, which is Seborgod agar at 20 degrees, because we know that this mold grows at 20 degrees outside in the soil. Now whenever we see it, we will see the fungal hyphae along with small babies, pear-shaped babies, which is known as the conida. Now serology is of little value, because this organism rarely infects and rarely causes a severe infection, so serology is of very little value. How do we treat it? We give the patient itraconazole, or in severe cases when it is causing bony lesions, we can give the patient amphotericin B. But be mindful, if the patient has a kidney disease, you need to give the patient liposomal amphotericin B.